Hi, I'm Dr. Amy Seary, and I'm one of the pediatricians here at Via Christi. I'd like to talk to you today about going home with your newborn baby. Whether it's your first baby or your third, fourth, or fifth, it can still be a little hard sometimes to remember what those first few weeks are like. One of the frequent questions I get is how to take care of a baby's skin. Well, babies do have different skin compared to us. It's much thinner, it absorbs things very easily, and they don't sweat like we do. They also don't have little goosebumps either, so sometimes it's very easy for them to get a little too hot or too cold. But taking care of skin really comes down to not overbathing. That's the big trick, especially during the winter time. Feel free to use baby products like Johnson & Johnson. I don't recommend using any kind of adult lotions or soaps. Sometimes they can have extra colors or perfumes in it that, remember, babies are going to absorb very easily. Additionally, sometimes babies are known to scratch their cheeks just a little bit because their fingernails get a little long. Don't bite your baby's fingernails off. Not a good plan. And sometimes using the little clippers seems like a good idea, but if your baby moves at the wrong moment, that's not an experience you want to have. So I recommend using a nail file each and every time. Additionally, you can always put little gloves over your baby's hands to help prevent them again from the accidental scratch. When it comes to how often you should bathe your baby, it depends on how dirty they might have gotten or what time of year it might be. Again, they're not rolling around and crawling a whole bunch, so other than the occasional spit up, your baby's still probably fairly clean. So a bath every few days is usually all that's needed. During the winter time, a baby's skin can get especially dry, so you may need to space them out even further. Also, and until a baby's umbilical cord falls off, you don't want to submerge the baby's belly button underwater, so it's more of the sponge bath wipe down kind. When it comes to taking care of your baby's umbilical cord, there used to be some pretty strong recommendations to do a lot of pretty fancy things, from certain alcohol wipes to other medicines. The good news is we know that doesn't do a lick of good. It just drives you crazy as a parent. So new evidence-based medicine suggests leave it alone. You just have to keep it clean, but you don't need to do anything special about it. Most babies' cords will fall off within about 2 weeks after it falls off. There's a little green oozy kind of stuff, that's normal, and it's normal for it to smell bad too, so now you're prepared. Lastly, in terms of baby boys who've had a circumcision, that should also be pretty well healed before you submerge it underwater. Once the umbilical cords come off and a circumcision's healed, then you can do the kind of baths where your baby can splash around a little bit more.